My name's Lisa Hoppy, and I'm going to talk to you today about rural practice issues. I am going to be a psychiatric mental health nurse practitioner, so my presentation is going to be definitely geared toward that. If you look on slide number 2, you'll see that there is a map over to the right, and I know that it's kind of a little bit small, but it's the state of Arizona, and all of the little dots show where there are mental health facilities. And you can see there's a lot of spaces where there is no care, particularly in Mojave County, Coconino County, and then down by Yuma. Also very close to the Mexican border, there really is not very much care. And then of course, North Central also, we have a huge lack of services up there. In addition to lack of regular services, we also have, there's not very many services for specialized things. Like for instance, opioid, medical assisted treatment for opioid substance abstinence. People have to travel up to an hour each way sometimes just to get care for that. Also, we don't have enough providers just in general that are spread out in rural areas. This means that there are reduced assessments, reduced medical compliance, and reduced access to therapy. In states where so not Arizona, but in states where they haven't expanded Medicare coverage, mental health care costs a lot of money, and many people just simply can't afford to get medical care in rural areas. So there are over 46 million U.S. rural residents. The rural population is likely to have increased usage of emergency department services for psychiatric issues because they wait longer to get treated. We see increased benzodiazepine prescriptions. We see increased suicide rates, and there's just lower mental health service usage because there just is lack of it. The Advanced Practice Registered Nurse is actually poised to help needs for rural healthcare. We have many college and university programs, just like the one that's here at Eastern Kentucky University, where we are specifically trained to help with the rural population, and we get special education regarding treating people in rural America. APRNs are actually more likely than medical doctors to provide rural medical health care. And some things that we have to think about from the APRN perspective is, how are we going to gain access to our patients? How are we going to provide them therapy, especially if we're talking mental health therapy? And then how will our patients receive their medications? So for the rural plan of action, one of the things that we can do is use a top tier health solution, which is actually telehealth services. So during COVID-19, they expanded many laws allowing the use of telehealth, and we've become pretty good at it actually. And those services have been expanded, increased bandwidth, and the secure delivery platforms that we have, secure apps, enable us to use telehealth services. And many nurses and practitioners actually really enjoy it. The other thing that we can do is sometimes a patient may need physical assessment, but we have watches, healthcare watches, oxygen monitors, blood pressure machines, and other remote tools where the provider can gain access even to physical assessment data remotely. Also, we can use mobile health clinics. Sometimes it's just not feasible for us to be able to use telehealth because maybe they don't have good service, maybe they don't have internet service, and so we can also use mobile health units. We can use mental health services can be integrated into the already established primary care and other medical service places. So this will, if you just add mental health to clinics that are already there, it will help to expand those services. Also, teaching mental health care to primary care physicians and to family nurse practitioners for easy things like or more common issues like depression and anxiety, and teaching the rural population how to foster better self-care, can also reduce mental illness like anxiety and depression. So just accessing quality mental health care definitely presents unique challenges for rural populations. We have lack of specialized providers, we have distance barriers, cost prohibitions, expanding the telehealth infrastructure and utilization, integrating mental health services into primary healthcare clinics, employing mobile clinics, and providing targeted patient education with evidence-based strategies can help bridge these gaps. With focused preparations, APRNs are distinctly poised to help provide leadership in improving mental health outcomes. Ultimately, a collaborative spirit across health disciplines paired with a commitment to innovations will be required to ensure quality health regardless of geography. While barriers persist, solutions emerging alongside technological advancement are a cause for optimism. The opportunity exists today to create meaningful change in modernizing mental health delivery across the rural communities nationwide. 2 questions to consider are there any general resiliency factors that can be identified and fostered in the rural community to put them at a lower risk for negative mental health outcomes? And also, how can unique issues related to specific rural populations like veterans or Native Americans be addressed to improve mental health outcomes in these populations?